Have you noticed your vision getting blurrier after 60, like looking through a foggy window? Or maybe straight lines seem wavy, letters fade, or nighttime lights suddenly have halos? These aren't just normal aging signs. They could be your first warning of diabetic eye disease. This condition affects millions of seniors and is one of the leading causes of permanent vision loss after 60. And the most dangerous part? It often creeps in silently. By the time you feel real vision changes, damage may already be advanced, and, in some cases, irreversible. In this video, I'll guide you through the 3 key stages of diabetic eye damage, what to watch for, when to act, and how to protect your sight before it's too late. So stay with me, and don't forget to subscribe for more trusted senior health advice. Because catching these signs early could save your eyesight or your independence. And be sure to watch through all 3 stages. This disease doesn't happen all at once. It builds over time, and missing just one stage could mean missing the warning your eyes are trying to give you. Coming up next, I'll reveal the most common early symptoms seniors ignore and why it could mean your retina is already in danger. Stage number 1. Early diabetic eye disease. Let me tell you about Jack, a retired teacher in his early 60s. He came in for a routine eye exam, thinking he just needed a new prescription for his reading glasses. But what his eye doctor found was something far more serious. Early signs of diabetic retinopathy. Jack had no pain, no redness, and he could still see just fine, but damage had already started inside his eyes. This is stage 1 of diabetic eye disease, known medically as mild non-proliferative retinopathy. It often begins without any obvious symptoms. The tiny blood vessels in the retina, the light-sensitive tissue at the back of your eye, begin to weaken. According to the Mayo Clinic, these vessels can develop small bulges called microaneurysms, which may start to leak fluid into the retina. At this stage, most people still see clearly. That's what makes it dangerous. You may notice slight blurriness, difficulty seeing in low light, or eye fatigue when reading, but nothing alarming. That's why so many seniors miss it, thinking, "Oh, it's just my age." But catching this stage early is critical, because once these vessels start leaking, the risk of swelling in the macula increases. And that's when your central vision, the part you use to read, drive, and recognize faces, can start to fail. Harvard Health emphasizes that regular eye exams, especially dilated retinal exams once a year, are essential for seniors with diabetes or prediabetes. It's the only way to catch this damage before vision starts slipping away. Have you had your annual eye checkup yet? Tell us in the comments. And if you've ever been told you have minor eye changes, what did your doctor say? Coming up next, in stage 2, you'll hear about the point when symptoms begin to interfere with your daily life and the damage becomes much harder to reverse. Stage number 2. Retina under attack. Even musical legends aren't immune to diabetic complications. Ray Charles, the beloved icon of soul and jazz, lost his sight as a child, but diabetes later in life made things even worse. Doctors confirmed that the disease accelerated the breakdown of his eye vessels, worsening the damage over time. His story is a powerful reminder. Diabetic eye disease can affect anyone, and it rarely announces itself loudly. And unfortunately, this condition is far more common than many realize. It quietly affects millions of older adults, often progressing unnoticed until daily life is disrupted. Evelyn, for example, a 67-year-old retired librarian. She started struggling to read recipes, noticed floaters drifting across her vision, and found that bright lights at night were becoming harder to tolerate. Assuming she just needed new glasses, she scheduled a routine eye exam and was shocked to learn she had already entered stage 2 of diabetic retinopathy. At this stage, the disease is no longer silent. The fragile blood vessels in the retina begin to leak blood and fluid, cutting off oxygen and causing swelling in the macula, the part responsible for sharp central vision. This swelling, called diabetic macular edema, is one of the leading causes of vision loss in older adults with diabetes, according to the National Eye Institute. Common signs you may notice at this stage include blurry or unstable vision that comes and goes, floaters, dark spots, or cobweb-like shapes drifting in your vision, trouble seeing in dim lighting or excessive glare from bright lights, a feeling that your eyes just aren't focusing the way they used to. The scary part? Many of these changes can be happening without noticeable symptoms, which is why annual dilated eye exams are so important for anyone with diabetes or prediabetes. But the good news is, this stage is still treatable. Doctors may recommend laser therapy, anti-VEGF injections, or improving control of blood sugar and blood pressure to slow the damage or even stop it from progressing. Have you experienced floaters, blurry vision, or light sensitivity lately? Tell us in the comments. Your story could help others recognize these early warning signs. If this helps you see your eye health in a whole new light, give it a like video and subscribe so you won't miss the steps that could protect your vision. Because in stage 3, we'll explore the most dangerous phase when your eyes begin growing fragile new blood vessels that can bleed suddenly and steal your sight without warning. Stage number 3. Vision in danger. This is the stage we never want to reach, but too many people do. Stage 3 is known as proliferative diabetic retinopathy, and it marks the most advanced, most dangerous phase of diabetic eye disease. At this point, the retina has been deprived of oxygen for so long that it sends out emergency signals to grow new blood vessels. But the body's response is flawed. These new vessels are not normal, they're fragile, thin-walled, and grow in areas they don't belong. Imagine trying to fix a broken sprinkler system using paper straws. That's essentially what your eyes are doing, growing weak, unstable vessels that can't withstand pressure. And when they rupture, they bleed directly into the center of the eye, a condition known as vitreous hemorrhage. These abnormal vessels can also tug on the retina, like pulling a curtain off its rod, eventually causing it to detach. According to the American Academy of Ophthalmology, this type of detachment can lead to sudden, irreversible vision loss, sometimes within hours. My friend, Robert, a 72-year-old retired woodworker, had lived with type 2 diabetes for over 20 years. He always thought his vision was good enough and skipped his annual eye exams. One morning, while reading the newspaper, he noticed a sudden flash of light in the corner of his eye. Then, within minutes, a dark curtain fell over part of his vision, like someone had closed the blinds inside his eye. By the time he got to the eye doctor, his retina had already detached. Even with emergency surgery, his vision in that eye was permanently reduced. What symptoms should you watch for? Flashes of light, especially at the edges of your vision. A sudden storm of floaters or black spots. Blurry, distorted vision that comes on quickly. A dark shadow or curtain moving across your sight. These are not subtle. If you notice them, don't wait. Go straight to an eye specialist. Treatment at this stage may require vitrectomy surgery, laser therapy, or injections to stop new vessel growth. They may not fully restore vision, but they can help prevent total blindness. According to the National Eye Institute, with good diabetes management and regular eye exams, most people can avoid this stage entirely. Taking care of your eyes doesn't have to be hard. With just a few easy morning habits, you can give your vision the support it needs, especially if you have diabetes. Here are 4 you can start today. 1. Check your blood sugar. Keep fasting levels under 130 milligrams DL to reduce pressure on your eye's blood vessels. 2. Drink water before coffee. Start with a glass of water to improve blood flow and keep your eyes hydrated. 3. Eat for your eyes. Add spinach, eggs, or oranges to your breakfast, rich in nutrients like lutein and vitamin C that protect the retina. 4. Move your eyes. Try slow blinking or focusing exercises to improve circulation and reduce strain. Doing these takes just a few minutes, but over time, they help protect your sight and support healthy aging. Which of these do you already do? Let us know in the comments and share any habits that work for you. Let's quickly recap what we've learned. Diabetic eye disease doesn't strike overnight, it progresses in 3 stages. It starts quietly, with tiny blood vessels weakening in the background. Then, vision begins to blur, floaters appear, and light becomes harder to manage. Finally, in the most serious stage, fragile new vessels can bleed or detach the retina, leading to permanent blindness if left untreated. But you're not powerless. You can take control right now by scheduling a yearly dilated eye exam. Even if your vision seems normal, make it a daily habit to manage your blood sugar and blood pressure, and adopt a few simple morning routines that support your long-term eye health. These small steps, done consistently, can protect your sight and your independence as you age. Was there something in this video that surprised you or made you pause? We'd love to hear from you. Drop your thoughts or questions in the comments below. And if you're ready to go deeper, be sure to check out our diabetes and blood sugar control playlist. You'll find more practical tips, senior-friendly explanations, and life-saving guidance to help you stay ahead of diabetic complications. If this video helped you, please like, subscribe, and share it with someone you care about. It might just save their sight. Thanks for watching. This is Golden Aging Health, and we'll see you in the next video.